And this week we have a very special guest who actually is coming into town for something particular, something very special happening in Montego Bay. But I'm not going to break all the news. I'm going to invite him onto our airwaves and have him
tell us all about
it. So we have Dr. Andrew Rosenthal, who is Associate Director of the Division of Trauma Services at Memorial Regional Hospital. Welcome to KLAS Sports FM 89.
Welcome.
Hi, good morning. Thank you so much for having me on.
We are extremely pleased to have you. I mean,
very grateful. We're hoping to get a wealth of knowledge from
you. Yes, take advantage of this opportunity. So how are you doing? How's Jamaica been treating you so far?
Oh, I'm great. You have a fabulous country and is the envy of those of us who have to live within the borders of the world.
You know that this is cold right now for us.
Yes, well, when you have to put a sweater on, then
yes.
I suppose you call it winter.
Yes.
We'll get a slight breeze and then we're like, oh my gosh, it's Christmas.
God, it's cold. But we're brought bad, sorry. But I really do hope that you have a fantastic time here. But want to talk specifically about trauma, because you are actually renowned for trauma surgery, correct?
Well, we have, I'm not personally, renowned for anything. But I will tell you that, trauma is increasingly in the news. And if you're paying attention to the newspaper or the radio or the television, you see what's going on around the world, or you're just looking outside your window, then you realize how much violence is there and how often, we have to look around the corner and be aware of our surroundings and be careful when we're crossing the street or when, you're doing anything that you would normally do where we become complacent.
Because anything can happen.
Happens. But
that's
not,
right.
But not just about, maybe an accident, but, as it relates to, driving or being hit by a car on your bicycle. But in terms of sports, though, sports-related injuries, what kind of trauma are you seeing in the scene in that aspect?
Well, I think now everyone is participating in sports. It's like the new religion. Everyone is playing basketball or football
and that's very good.
Soccer, and it's wonderful. And there's a enormous benefit to people being active. But we do have to remember that it's extremely preventable. Many of the injuries that we see when people are bike riding, they should be wearing a helmet. When we are doing things that involve contact sports, we really need to be careful and be aware that there are potentials. Right, there's potential for injury, and sometimes it's mild, and sometimes it can be quite serious. We see a lot of injuries related to contact sports, like concussion, and concussion is something that sometimes it doesn't look very serious because someone has very little in the way of external signs of injury.
So everybody thinks they're okay.
Right. They get knocked out and they look like they're okay, but on the inside it's very difficult to tell sometimes.
The thing is, right, there might not be any bleeding or anything like that. So what should somebody look out for before they decide, listen, I'm going to actually go to the hospital or a doctor? Because I fell. What's some of the symptoms they can look for?
Well, we always would like to know, how do you feel compared to how you normally feel? When people don't feel well compared to their normal activity level, if they can normally participate in sports, but today they're having chest pain, then that's something that's different. If they have headaches, then that's something that's very unusual. When I worry about people is when they tell me, listen, I have never had a headache like this before, or I can't, I can't seem to catch my breath.
Wow.
Or, something that's unusual that just makes you think, wait, this is not just a sprained ankle.
Yeah, let's get a MRI scan or something.
Let's get this checked.
Yeah, well, sometimes it does go quite that far, but most of the time we just ask people to have, appropriate common sense about, not doing anything crazy and being careful, and being reasonable.
The thing is, sometimes these traumas, I know you can be careful and safe and be protective, but for instance, we had Kemar Bailey Cole come in, I believe it was on Tuesday. He's one of our Olympic stars, track stars, and he was just running. He was in a race and he was running hard, and his two hamstrings just completely pulled.
Just so to know.
Right. Well,
how do you prevent that?
I would say, when people are at a level of Olympic capacity, then that's something that's geared very specifically towards certain levels of activity. But I would recommend that people should know what their limits are, and they should stay hydrated, and they should stretch before they do something like running or something like lifting. Then we do ask people to use basic common sense in terms of being hydrated and somebody else, or having a partner when you're swimming, because sometimes when people are injured or there's a problem, if they're alone, they're really dependent on some bystander to come by to help them. And we always would want someone to have a partner.
Okay.
That's the safest way to call for help or to get help when you need it.
Okay.
I love that. I really didn't even think of that one. Thank you.
Okay. Can you actually just jump in and tell us a little bit about the 15th Caribbean Neuroscience Symposium that you're actually down for?
Well, this is a wonderful conference that I attended last year. I'm going to attend this year, and I'm really flattered that they continue to invite us to participate in this. It's a wonderful conference that discusses all kinds of state-of-the-art technology and state-of-the-art surgery in order to help people in a way that we didn't have the capability to do it 20 years ago. So this is really an up-to-date on how to bring state-of-the-art care and how to make that the standard of care.
Okay.
What we would like is to allow community physicians and community healthcare providers some access to what's going on at the highest level university programs, and to realize that much of what people are doing is really is able to be done even on a regional level, even in local community hospitals. Many people can do a great many things, even though they may not have the Harvard technology, for example, or the things that we associate with, the greatest level of care for some senator. It doesn't mean that we can't provide a great level of care for people in our own local communities. And the trauma is so pervasive that everybody knows that they're going to be confronted with it. Whether you live in Oklahoma in the United States or whether you live in Kingston or Montego Bay, everyone is going to face it at some point where they are forced to deal with it, and when you're prepared for it, it's much easier to achieve a better outcome.
That sounds fantastic. The ECMO, that procedure, it's a machine that uses, the machine helps to control the function of the lungs, correct? And sometimes the heart.
This is a machine that has been around for many decades now, but obviously the technology has come so far that it's become very prevalent in many hospitals now. Basically, it is the heart-lung machine where the oxygen is put into the patient's bloodstream, but it's done outside the body. So it's extracorporeal. That's what the EC is. And then the MO is for membrane oxygenation. I know it sounds complicated, but basically the blood comes out of the patient, goes into the machine, gets its oxygen, has the carbon dioxide removed, and then it's put back into the patient. So the machinery is doing the job that the lungs would do.
That is incredible technology.
It's absolutely incredible. And initially it was something that was used for heart surgery, in order to correct, a baby's heart that wasn't functioning well, and you had to put the patient on the heart-lung machine. But now what we've done is we've brought that technology into other fields. And what they're able to do now, when we have the ability to use ECMO, is to oxygenate someone whose lungs can't do it. And if your lungs can't do it, really, unless you can get an immediate lung transplant, you're not going to survive that.
Ah, got you.
But there is
ECMO,
hope.
So ECMO does that, and it allows people, really it gives the lungs a holiday so that they can recover from whatever injury they have.
Fantastic. That is incredible.
Could you tell us a little bit more about the symposium and where it is, the dates, the location, and if there's like an admission?
Well, the website is very very clear. I don't have it in front of me at the moment. But the Caribbean Neurosciences Symposium is in Montego Bay. It begins on the 26th of this month, and I think it runs through the 29th or even the 30th. I'm just one of many speakers who are there, and they're all really fabulous speakers. The program is able to attract people from all over the world. There are people who come from Stanford, they come from New York. I'm coming from the Hollywood, Florida area, and it's nice to see the way that different people practice in different places, because what you realize is that for the most part, we're all doing the same thing with a little bit of different flavor, and people learn, well, you know what, maybe I could consider that at my institution, or maybe I can offer this for them to do at their institution, and it's really a beautiful way to just expand knowledge. And the conferences that this particular symposium has put on has always been so well received by the attendees that the audience continues to grow.
Good.
Fantastic. It almost sounds like there's a creative process in the science area, all the flavors and styles that people are bringing into it. And we definitely are very happy that this is happening, especially in Montego Bay and in Jamaica. But just tell us a little bit more about yourself and your background, and just how you got into the field and how long you've been working in this area.
Well, I think my story is not terribly exciting. I grew up in California, and when I went to medical school, I really didn't have a great idea of what it was that surgeons did. I think that what we see on television is not always representative of real life.
No.
And when I went to the hospital and I started to see the way that great trauma surgeons could get anybody through the night, they were taking people who were thrown off a motorcycle or fell off of a balcony or were stabbed or shot. And the ability of those surgeons to deal with that patient and get them through the night or through their course with calm affect, with optimistic confidence was a beautiful thing to me. And I said, I want to do this, and I want to be able to offer something regardless of where I am. And when you're doing trauma or emergency surgery or emergency medicine, it really means that you can go anywhere in the world and do it. You could be in Kabul, Afghanistan, or you could be in downtown Los Angeles, or you could be in a very rural area of Jamaica, and still as a doctor, as a surgeon, you can take care of basic problems. People who will have a farm accident or be thrown off of a horse or be in an altercation. And so it was that sort of that ability to deal with anything that walked through the door that really attracted me to the field. I think that many people see medicine as a glamorous field, and sometimes it is, but other times it's really a matter of common sense and first aid. And I like to remind people that many of the things that we do as doctors, they are capable of doing as a lay person when someone needs help.
Right.
People who can respond to an incident and have the ability to hold pressure on a wound that's bleeding, or to provide CPR to someone who needs, chest compression. Those kinds of things we are all capable of.
True.
And it's it's
just a matter
education.
of getting the knowledge. Exactly. I want to just really thank you so much,
Dr.
for
Rosenthal,
coming and being a part of our Sports and Lifestyle Fair. Good luck and all the best with the symposium, and we hope that we'll be able to catch up soon again.
Well, thank you so much for having me. Have a wonderful day.
You too. Thanks so much.
Thank
All right,
you
that's
so
Dr.
much.
Andrew Rosenthal, Associate Director of the Division of Trauma Services at Memorial Regional Hospital, and that was Recharge.